It's my pleasure to introduce the fourth speaker for the morning. Andrea is here also from the University of Guelph, and will give a presentation on West Nile.
Thank you. Today I'm going to talk about some work that has been done as part of my PhD thesis. I'd like to first thank the members of my advisory committee, Dr. David Pearl, Dr. Olaf Burke, and Dr. Jane Parmley, as well as Dr. Ian Barker, who was instrumental in developing the surveillance program for corvids for West Nile in Ontario. So we're going to be looking today at comparing the surveillance for detection of West Nile in Ontario, looking at using survival analyses and spatial scan statistics. So just for a brief outline of my talk today, we'll go through a little bit about what West Nile virus is. If you've been in any of the previous talks in the other room, this might be a bit of a review. We'll talk about the data sources that we are comparing for our study, and go through some of the study objectives. We'll talk about the materials and methodology, particularly survival analyses, spatial scan statistics, and using model-adjusted scan statistics. And then we'll talk about some key findings and discuss these. So West Nile virus is an arbovirus. It exists in a primary transmission cycle between birds and mosquitoes. And during each season, once it sort of reaches a point in the cycle, it can spill over into incidental hosts, humans and horses, which are dead-end hosts. Most people who are infected don't show any clinical signs and won't know that they have been infected. About 20% of people will develop flu-like symptoms, and rarely it can result in severe neurologic disease that can be fatal as a result of inflammation of the brain and the meninges surrounding the brain. For prevention, we don't have a vaccine for West Nile for humans, so we rely on comprehensive surveillance, breeding site reduction, elimination of standing water, as well as public education, promoting personal protection, recommending limited exposure to mosquitoes. And then we have targeted mosquito control, which in Ontario has consisted of larviciding. So for this study, we are looking at comparing some sources of surveillance. So we have enhanced passive surveillance of found dead wild corvids. So these are crows, ravens, and blue jays, which was found early on that there was 100% or near 100% fatality rate in these species, and they're easily identifiable by the public. So it was a perfect way to collect samples to test for West Nile. The program was provincially supported up until the end of 2008, so we'll be looking at data that was collected until then, because after that time there's been much more limited testing of found dead birds. And something very important with this research is that once a few positive dead birds were found in a public health unit, the testing was stopped in that area because it was assumed that West Nile virus had arrived, and just to sort of minimize the expense of the testing. We also have across Ontario active surveillance of suspected mosquito vector species, and the main ones that we focus on are Culex pipiens and Culex restuans, which are primarily bird-biting mosquitoes, but they do represent about 80% of the risk for human infections as well, so they will bite people too. And then because this is a reportable disease, we have passive surveillance of human cases across the province. So this brings me to the objectives. We wanted to look and try to compare these programs for surveillance of West Nile virus. And because we had the limitation of testing with the bird data, we decided to look at it from a time to detection perspective. How quickly are these sources of information finding West Nile virus in an area? Do they provide the same information or different? How quickly do they detect West Nile in an area, which might be more timely detection? And what other factors are influencing the time to detection? And then how does this relate to when human cases start to appear? So we use two primary methods. The first one was conducting survival analysis. The second one was looking for clusters of public health units that detected West Nile virus early in the season. So just for a little overview, survival analysis uses time to event data. And so we were looking at the time to the first positive test, either in the crows or the mosquitoes or the humans. You can, just like other models, you can include other of interest, and you don't need to only look at positive outcomes. You can include censored data, or in our case, public health units that didn't detect a positive case. So there are 36 public health units spread out across Ontario, and they're responsible for surveillance of West Nile on a local level. And then they've been classified by Statistics Canada into 7 geographic health regions, spanning from the northwest to the southwest of the province. They've also been classified according to a combination of sociodemographic factors and classified as so-called peer groups, sort of based on how urban or rural they are. So we use these classifications as variables in our models. We developed multi-level Cox proportional hazard models, looking at the year of surveillance, the program Corvid versus mosquito, the geographic region, sociodemographic profile, as well as latitude and longitude of the health unit. We included a frailty, so this is sort of like a random effect term for the public health units, which allows to control for individual public health unit level factors that might be influencing our findings. And the measure of association is a hazard ratio, which I will sort of describe a little bit coming up. We also use spatial scan statistics using a program called SAT-SCAN, and it has historically been used for count-based data, but more recently it has been developed for use with survival data, and it's based on an exponential survival distribution, but it is robust to other survival distributions. And so if you can picture, we were looking for space-time clusters with this cylinder here. The space is represented by a circle that moves across the map, and time is represented by the height of the cylinder, which can change over all of the locations. And you're looking for areas with faster or shorter survival time, faster detection in an area compared to that outside the area. And then finally, we conducted spatial scan statistics using results from some parametric survival models, which allows us to control for some of those differences that we were finding in terms of sociodemographics and geographic region. So we adjust the survival times based on the model coefficients, and then you run the scans again, and this removes the effect of potentially confounding factors, so that what you're finding is sort of more reflective of a true or faster than expected detection in an area. So I'll first talk about the results from the survival models. We found that there was a significant effect of the data source, or the program, Corvid versus mosquito. Geographic region significantly influenced time to detection, sociodemographic profile, and the year. So we also found interactions between source and year. So we found that over time or over different years, one versus the other source might be detecting West Nile virus more quickly. And there was also an interaction between data source and the sociodemographic profile. So a hazard ratio is it's a comparison between two groups. So it's looking at the rate that something is failing, or the rate of detection, the speed of detection in one group relative to the other. So if you have, for example, a high hazard ratio would be a ratio over 1, where one group is failing more quickly than the other. And we see here for geographic region, the public health units in the eastern part of the province were detecting West Nile virus less quickly than those in the central western region. They were also detecting West Nile less quickly than those in the central east and the southwest. And then the southwest detected West Nile virus less quickly than those in the central east. And then when we looked at some of the interactions, we saw that over the early years of the program, 2002, 2003, and 2004, as well as 2006, data coming from the dead corvids was detecting West Nile virus much more quickly than that coming from mosquito pool tests. However, in 2007, that changed, so the mosquito pools were detecting West Nile virus more quickly than the dead corvids. As well, we found that in urban centers and rural regions, West Nile virus was detected more quickly using dead corvids in comparison to mosquito pools. The results of the scan statistics show that in 2002, using the dead corvid data, there was a cluster of early detection in the southernmost tip of Ontario. And then in 2003, 2004, and 2007, it moved slightly northward, sort of to the more populated regions of the province. However, in 2006, we found this large cluster of early dead bird cases in the north of the province. Using the mosquito pool tests, we found clusters generally located within southern and central Ontario. These are the most populated areas and also where the Culex species are the most common. It's also the warmest part of the province, which drives mosquito populations and amplification cycles, so it wasn't entirely surprising to find clusters in these areas. When we looked at the human cases, again, we found the most timely detection occurred in the regions where people are located, the most populated areas, which we also know is where we are in close contact with Culex species habitats, and there is increased likelihood of bridging vectors biting people. However, when we adjusted for the sociodemographic peer group and the geographic region, in 2006 we found that the clusters overlapped between the dead birds and the human cases. And then when we look at the timing of the clusters that were detected, you can see that clusters are detected by dead birds relatively early in the season, and they do provide a few weeks, often up to even a month, before the first human cases are being detected. So they are sort of more likely able to predict when or where human cases are going to occur. And there was quite a lot of overlap between the locations of the clusters as well. However, the mosquito pool testing using this technique doesn't show as much reward in terms of being able to predict when human clusters are going to occur. There's a lot of overlap in terms of time, although there's also a lot of overlap in terms of space. So just to briefly go through the major findings, we found that earlier in the program, the dead corvid data provided faster detection in comparison to the mosquito pool data. However, in 2007, there was that change where the mosquito pool data was detecting West Nile virus more quickly. We think this might be related to some changes in public reporting of dead birds. There was probably waning interest by that time, as well as we know that the corvid population experienced a die-off related to West Nile, and they may have had changing immunity as well. And then we also know that as time went on, the placement of mosquito traps became probably better and more likely able to find West Nile virus in subsequent years. So we found differences by geographic region and sociodemographic profile, and we think that these might be due to differences in the likelihood of public detection and reporting of dead birds, differences in public perception of risk depending on where they live, as well as environmental features that we haven't included, factors that influence both corvid and mosquito abundance and amplification of West Nile virus in that cycle. There was geographic overlap between the bird, mosquito, and human clusters during most years. The mosquito pool clusters are spatially more similar to the human case clusters, but they provide less timely information using this technique. And adjusting for those sociodemographic and geographic factors allowed us to detect a cluster of cases using the dead bird data in 2006. We think that the dead bird clusters showing a more northern distribution during 2006 might also represent movement into naive populations of birds, and as well, I mentioned earlier, the impact of reduced bird populations and immunity in the southern areas. So in conclusion, time to first positive dead bird and mosquito pool tests using survival modeling and spatial statistics offers a new approach for West Nile virus surveillance. Differences in the spatial distribution and the time to detection may provide complementary information for public and animal health surveillance in Ontario. I'd like to thank Dr. Curtis Russell from Public Health Ontario for help acquiring the mosquito pool and human case data, and as well as my funding from the Ontario Veterinary College Fellowship and a Margaret A.B. Maxwell Memorial Scholarship. Thank you.
Do we have questions for Andrea? I guess my question is, should we be having the crow PMs open up again? Mm-hmm. It looks like we can almost predict a month mm-hmm. before the human cases.
Yeah, I think it's worth thinking about. I think it's, the mosquito pools it is hard to find West Nile sometimes with that, and dead birds, we know. The crows, if they die, they are quite likely infected with West Nile when it comes into an area. So, I mean, it is endemic now, so there might be immunity in the birds that wasn't present early on, but it's interesting to see how quickly they found it. Yeah.
Other questions? Yes.
So with West Nile, not everybody who's infected becomes symptomatic. Was there any thought about looking at previous year's cases or controlling for those to determine future human cases? Because as more people are exposed, the less likely that people
True.
Detect them to be positive.
No, we haven't thought about that. That's a good point, though.
Any other questions? Yes.
Just a point of clarification. I'm sure you mentioned it. I'm assuming that your timing zero start point for each of the survival models was at the beginning of testing?
Yeah.
Or was it some other?
The beginning of testing for that year, yeah.
If there are no more questions, thank you again.